Good morning, and here we are in Decatur, Georgia, United States of America, 1524 Lavista Drive on the second floor. And this morning we are continuing with our CME, which is an abbreviation stand for our continual medical education, continual mechanical engineering education, and continual matrices education, as well as continuing mathematical engineering. So it has a multiple reasoning, this CME. So this is now CME, continual medical engineering education. And in continuity now, we are on some pharmacokinetics and pharmacochemicals derivatives, and yours truly, Dolphy Gilpin, is here. Okay, Procardia. What I've done here, I've imaginatively pull out these abbreviations, NP, PCA, which is for Lavista and Procardia, and warfarin, double FN, and which its brand name Coumadin, CDN. And as you will see on the reverse side, there's going to be a couple others, making up a 5x12. And we have pulled out or extrapolated now some of these abbreviations, and then construct now the chemicals consideration for them. So then we could say this is enhanced now by our Amz5x12MIPCA. So now the first one, and here we have now the chemical structure, structural formula, and Lavista is a calcium channel blocker used to treat hypertension and to control angina pectoris, a type of chest pain caused by reduced blood flow to the heart. Other use of this Procardia is the Raynaud's syndrome, preeclampsia, cesarean derma, and chilblains. Well, chilblains are sort of a dermatological sort of a malignancy. And we have now NP for the Lavista and PCA for the Procardia. The same substance, one is a brand name and one is a generic name. And this is now the chemical structure for it. Now, the Procardia was one of the pharmacochemicals that was used back during the 1990 to 1996 specialized medical studies by yours truly with the PIFA indigent patient program. This is one of the volunteered drug that was given samples in the volunteer indigent patient program by PIFA in 1990-1996 specialized medical research. Warfarin was also one of them. I think it was produced or manufactured by DuPont at the time. So here we have warfarin, and with the brand name now Coumadin. Warfarin brand name Coumadin, chemically it is now 3-acetyl benzyl 4-hydroxycoumarin, and this is now the chemical structure for it. Notice I have 4 sort of benzene ring here, OH, and this is now a double bonded oxygen here, OH, hydroxyl group, double bonded oxygen and oxygen at this end. It is used to treat blood clots such as in deep vein thrombosis, DVT, or pulmonary embolus, PE, or to prevent new clots from forming in the body. Now, warfarin is commonly called a blood thinner, but more accurately, it's an anticoagulant. And this property of Coumadin to prevent blood clots, can help you to reduce risk of stroke and heart attack, or what do you call myocardial infarctions. So there we have it now, Lavista, Procardia, and Warfarin and Coumadin. And we have pulled it out now from a 5x12 with these abbreviations, NPE, PC, NPE, Lavista, PC, Procardia. Same substance, one is the generic name and one is the brand name. And Warfarin and CDN. Notice that these abbreviation is not necessarily consistent with the brand abbreviation that would be given by these companies like that produce the drug, like DuPont, or in this case it would be Pfeiffer for the Procardia. Another company like Merck, Sharp and Dome, and Eli Lilly and Company, and other pharmacochemical sort of companies that produce these generic drugs. But it was personally drawn from my personal portfolio to assist and enhance now in the 5x12 matrix in the pharmacochemicals configuration. So let's briefly turn it around now and see the other 5. We have done 5 of them consistent with 5 pharmacochemicals that would have been consistent with the 5x12 matrix. Here we have now Isoniazid.
Okay, keep it straight up. Okay.
This is anti-TB, anti-leprosy sort of chemical drugs here. And this is its chemical structure. Formula C6H7N3O. And we have the ISD for the abbreviation in the 5x12 matrix. And notice that Isoniazid and Rifampin is a combination that is used together simultaneously to prevent what is it, TB? Yeah, to prevent the TB. Okay, we have now the Mendel-Montauk test, or the Montauk test is one of the major tuberculin tests. And in this test, there is a spirit with a tuberculin instrument, and we containing the tuberculin. And after 3 days, if a bump or swelling is observed, a positive is confirmed. Now, indicative of the TB germs in the body. Further testing is necessary to diagnose the TB disease. Know that this Montauk test, skin test, does not necessarily diagnose the disease of tuberculosis, but that the germ or the bacteria of TB is in the body. Now, the combination of Rifampin and Isoniazid is used to prevent the spread of this tuberculosis. So these two drugs, with the Rifampin structure, which is this sort of complicated looking structure here, is the structure for Rifampin. C13H58N4O12, the molecular formula. And last in the 5 group of pharmacochemical would be now cogentin, and this was also in the group in the 1990 to 1996 specialized medical studies research. And this benztropine has an anti-muscarinic, antihistaminic, and local anesthetic effect. It's used in the treatment of Parkinson's disease, including intravenous or intramuscular, including tremor associated with the disease. And it is administered in the intravenous, intramuscular, and the oral tablet route. And you have the cogentin structure, you know, and which is benztropine mesylate. And this part here is the benztropine, and this part here is the mesylate. This is the mesylate structure here. which is the mesylate plus here, and this is the mesylate structure. And we have a couple of abbreviations here that could have been used in my personal portfolio at the time for the abbreviated in the 5-cos-12 in the pharmacochemicals configuration. BZE for benzopyne, and BNE or BZP or BZM, which would be benzopyne mesylate. The mesylate structure is this specialized with the sulfur and the 3 oxygen double bond, and this one here for the mesylate part. And the other part here would be the benzopyne portion. And the two combined would be benzopyne mesylate, which is cogentin. And as we said, cogentin is one of those psychiatric sort of a drug with an anti-muscarinic and antihistaminic and anesthetic properties. And this property can help to reduce tremor associated with the Parkinson's disease. So it's using to help control Parkinson's disease or Parkinsonism. So this is the 5 drugs for this one, and 2 of them is used in combination, the Isoniazid and the Rifampin, for the tuberculosis to prevent the spread of tuberculosis. And then we have independently now benzopyne, which is cogentin, and on the reverse side we have Procardia, which is nifedipine, and the other making up 5. So that's it. We will return with some other Amz5x12MIPCA enhanced pharmacochemical structures and their brief applications, properties, and chemical structures. So let's take a break here, and then we'll return with some more Amz5x12 enhanced pharmacochemicals.